Sentinel events and near miss events. So, what is sentinel events? It is an unanticipated occurrence involving death or serious physical or psychological injury to the patients or any visitors. They signal the need for immediate investigation and response. Here are the in this picture you can see some of the common sentinel events like suicide, wrong site surgery, surgery in the wrong area or wrong organ surgery, medication errors, delayed treatment, which may have resulted to death or any physical or psychological injury, fall, restraints, others. So these are the examples of sentinel events. You don't expect it to happen. It happens without any prior um, signs and symptoms. So sentinel events may include an unanticipated death. You were following through the proper treatment, but unfortunately it led to the death. Major or permanent loss or function related to the patient's course of illness or underlying condition. The patient came to the hospital with some other illness, but during the treatment process, the patient suffered a permanent major loss of function, which is not related to the illness for which the patient was admitted in the first place. Wrong site, wrong procedure, wrong patient surgery. All these are examples of sentinel events. Transmission of a chronic or fatal disease or illness as a result of infusing blood or blood products or transplantation of organs or tissues. So these are examples of sentinel events. Hospital acquired infection which became fatal. That's an example of sentinel event. Infant abduction, kidnapping of children or infants from the newborn cradle, etc. So, an infant sent to home with wrong parents. Rape, workplace or violence such as assault or homicide of a patient. Any workplace violence towards the staff member, practitioner, medical student, any trainees, visitors, or vendors while on the hospital property. If any kind of sexual or workplace violence or any homicide or any assault takes place within the hospital premises to anyone who is within the hospital premises, it becomes a sentinel event. So, what are non-sentinel events? They do not cause any harm to patient or anyone involved. Any malfunctioning equipment, but it didn't cause any harm. Lift failure, for example, is a non-sentinel event. So these do not have direct effects, but they have indirect effect. They will affect the internal quality of the hospital. So prevention policy. Hospital leadership has to address the sentinel events. They should have a written policy in place which has to be followed if at all a sentinel event occurs. And the employees should be trained how to handle it, how to go about these protocols and policies of sentinel events. Root cause analysis has to be done. Within 45 days of the sentinel events, root cause analysis has to be done. Root cause has to be found out. Usually the technique used is 5 whys. After finding the root cause, you have to take actions to prevent that root cause in future. Within 45 days, a report should be made on the sentinel event and it should be submitted to the parties who were violated and towards the hospital leadership. Corrective and preventive actions has to be taken. It will follow up with the root cause analysis. Recording should be done of every sentinel event which took place, and that will be the reference for future protocols. Adverse incident form should be available at every wards and every department. So the person or the staff member who has witnessed the sentinel event, they can write down their witness information in written format. Oral format is not accepted. Written format is preferred more than oral format. Staff should be trained after any sentinel event how to handle such cases. Identifying an incident as sentinel event is not an indicator of legal liability. Just because you have identified a medication error, but if the patient was saved, it doesn't become a legal liability. A near miss event, near miss is an unplanned event that did not result in any injury, illness, or damage, but it had the potential to do so. So result was good. Result was not injurious. Result didn't cause any damage, but if proper care was not taken, this event could have resulted in either injury, illness, or any kind of damage. That is called the near miss event. So near miss events applies to more than potential medical errors. Every medical errors are near miss events, but it is more than that. Hospital establishes a definition of what is a near miss event and what type of event should be reported as near miss. They have a set policies of what events are considered as near miss, but you can't have such policies for sentinel event because it is unplanned and anything abrupt can be reported as sentinel event. Reporting mechanism is always put in place, and the staff nurses and the medical staff are trained to how the reporting mechanism goes, whom you should for example, a staff nurse has to report a near miss event to her in charge rather than directly meeting up with the nursing superintendent. So there is a process to aggregate and analyze the data to learn where proactive process changes will reduce or eliminate the relevant relative event or a near miss. So you can apply either Lean or Six Sigma or any form of process improvement management techniques here, so that in the future you can eliminate or the same near miss events. The hospital has a definition of near miss. The hospital defines what type of events are to be reported as near miss. The hospital establishes the process for reporting the near miss, who should report what to whom. Data is analyzed and actions are taken to reduce the near miss events like corrective actions and preventive actions. So on any given day, there are around 3 lakh unsafe act practices going on in a hospital. Out of that 3 lakh unsafe act, 600 are near misses, 30 are minor near misses, 10 are serious near misses, and one may become fatal. This fatal near miss is a sentinel event. So I guess that point makes it clear the difference between near miss and sentinel event. Thank you.